Welcome. My name is Christoph Marcin. I'm a dermatologist in Stockholm, Sweden. I'd like to share with you some examples of how I assess and treat patients in my clinic to maximize the treatment outcome. Apart from pigmentary changes, we can also notice fine lines on Katrina's forehead, around the eyes and cheeks. We can also see that the quality of her skin elasticity is reduced. In conclusion, this makes Katrina a great candidate for the refresh category. As with all injection treatments, it's of utmost importance to carefully disinfect the entire treatment area. In my clinic, I like to start to focus on specific static lines and afterwards blend the product into the rest of the skin. This way I get an emphasized result on those lines, but also improving the general look of skin. The injection is done very superficially by inserting the entire length of the needle and injecting small droplets on the way back. If you listen carefully, you can hear the audible feedback from the smart click system. Each click indicates a 10 microliter droplet injected into the skin. I continue in this manner all the way along the cheek, radially in the same direction as the fine lines, spacing the injections about 1 to 2 centimeters apart. Restylane SkinBooster is intended to improve skin quality, not to be used as a facial filler. In case your patient is sensitive to pain, bruises easily, or has a social event upcoming, some practitioners might prefer the use of a microcannula. I prefer microcannula especially around the mouth and around the eyes, where there are a lot of fine vessels. Studies have shown that the results of Restylane SkinBoosters are equal regardless of if you prefer to use sharp needle or microcannula. I start by piercing through the skin with a needle slightly larger than the gauge of your microcannula. Simply insert the cannula through the skin, turn it around immediately. You should see the contour of the cannula but not its color. I carefully forward the cannula and inject small droplets of product on my way out. If you prefer an anti-grad technique, that works just as fine. And of course, also with cannula, you have the option of using the smart click system as an audible feedback of your injection speed and quantity, delivering a 10 microliter droplet with each click. Try not to overfill the upper lip. Again, Restylane SkinBooster is intended to improve skin quality. It should not be used as a facial filler. As a last step, we inject Restylane SkinBoosters onto Katrina's forehead. For this area, due to thin tissue coverage, I choose Restylane SkinBoosters Vital Light. When treating the forehead, be careful not to inject intravascularly. Simply inject small droplets intradermally all along the forehead. Make sure to only insert the tip of the needle to avoid injection of the plane where the vessels are. When you feel that the tip of the needle is becoming blunt, don't hesitate to change it. Space your injections about 1 centimeter from each other. Altogether, I've injected 1 ml of Restylane SkinBooster Vital on each cheek, chin, upper lip, half of Katrina's face, as well as half an ml of Restylane SkinBooster Vital Light on the forehead, combining sharp needle and cannula technique. It's important to inform the patient that the final result will first be visible a couple of months after the completion of the treatment regimen. In other words, the results build up gradually.